Hey, hello, all you wonderful ladies. Happy Wednesday. Make sure everything is working properly. Hopefully, everybody can hear me and see me okay. And we're going to get started while we wait for anyone else who wants to join us. I'm going to say my disclaimer. My video, my volume, it's every time. Okay. Anything that I say tonight and during this Wellness Wednesday is not health advice, it is health information. Um, don't start taking or stop taking or change the way you're taking any of your medications. Uh, and this will definitely apply to tonight's topic as well, right? If you feel like you need to, please first consult with your primary provider or your prescribing provider so that they can help you make the appropriate adjustments. And we're going to be talking about sometimes what effect those adjustments have. And then by attending tonight's Wellness Wednesday, we do not establish a doctor-patient relationship. All right. And it's always a pleasure joining you guys, being able to share some information with you. And as I've said before in my master classes, that levothyroxine and really any synthetic version of the T4 thyroid hormone doesn't work 80% of the time. And there are reasons for this, obviously. It is a synthetic, so we may find problems with being able to absorb a synthetic hormone that is not like our own body's hormone, or not exactly like it. Um, or there's other factors that are at play in your body that don't allow you to utilize it or get the full benefit of taking it, and that therein lies the problem with this topic. You know, what this topic is uh, based on, really. And ever since the we started this group, 2023, so many of you ask about or assert that you have side effects from taking thyroid medication, taking levothyroxine especially. And maybe one of the reasons why I always have lots of ladies asking about getting off of the medication, even after, taking it for so long. And so many of you have been on these medications for so very long, years, decades even. And so we're going to discuss the side effects of taking thyroid medication and to see if we can get a clear view on these treatments and just try to take a common sense approach to all of this too. And also, so many of you think that because these are pharmaceuticals, that they are simply not good for us. Now, I agree to a point, but I know better. And I understand that I understand thyroid physiology. All right. But that won't be my entire focus tonight, as I want to discuss the side effects. But I'll touch on some of the aspects of thyroid physiology to explain some things. Now, I always talk about the physiology of the thyroid during the master classes that I give, and I get right into the various lab markers that need to be checked to fully evaluate the various more than 20 patterns of hypothyroidism. But thyroid hormone replacement treatment is different than most medications, right? And really should be thought of as hormone replacement therapy for your thyroid hormone. And with that said, it does have its downsides, for several reasons. So let's explore some of those. The most common side effects of levothyroxine would include hair loss, palpitations, nervousness, weight changes, all right, sweating. Okay, all of these stem from imbalances that disrupt T3 driven metabolic processes. So if you attended the class, you learned that our thyroid mostly produces T4, and then it has to convert to T3, and 70% of that conversion happens in the liver. but 25% or so of that conversion from T4 to T3 happens in the tissues, in the periphery, in your nervous system, um, in your hair follicles. And so those are the most common side effects. Now, notable but less common effects would include like headaches, fatigue, even nausea, and diarrhea, and other gastrointestinal problems. So those are kind of the next common, but I'm not going to focus on those as much as far as going through mechanisms because I'd like to talk mostly about these, the most common effects. So we'll start with hair loss as a side effect. Okay. So probably the most common one that I hear about with taking levothyroxine is this hair loss. Okay. And um, I'm just going to show you a visual here. Reasons why thyroid replacement would cause hair loss. And so just to give you an illustration, all right, of what what this means. Okay, so incorrect dosing is going to be the most common thing relating to hair loss for levothyroxine causing hair loss. There's always an adjustment period, okay? Um, and this means that it takes about 6 to 8 weeks taking a new dose of levothyroxine to really adjust to it. And that's why most doctors will say, well, let's wait 2 months before we retest. Okay. And then there can be nutrient deficiencies relating, underlying nutrient deficiencies. But when you take levothyroxine, that requires, because it is a synthetic hormone that's going to do its job, it requires nutrients from your body too. Remember, it takes nutrients to convert T4 to T3. And so we'll talk a little bit more about that. Autoimmune conditions, underlying autoimmune conditions, certainly can be a factor in having this symptom, this side effect with taking levothyroxine. All right, now medication excipients, meaning the additives, the ingredients, not just the main, hormone component of the medication, but the extra ingredients can cause problems and lead to hair loss when you're taking this levothyroxine. And then, of course, stress factors, right, has a little bigger influence. Uh, so just having underlying stress, and that's something that we definitely talk a lot about in the masterclass, but uh, when you're under more stress and you start taking this thyroid replacement, cortisol from the stress will interfere with thyroid hormone conversion. Okay, so there it comes back to conversion. Okay, so let me talk a little bit about changing doses and Hashimoto's. These are, and you can't forget other sorts of conditions, right? Like insulin resistance. So with changing doses, excuse me, that's going to be the most common reason why you'll get hair loss associated with taking this. Hashimoto's, because it's so common, and I do talk about this a lot in the master class, having these underlying autoimmune conditions, especially relating to thyroid function, will lead to perhaps more side effects with taking levothyroxine. It's your doctor. Your doctor's trying to fix this issue. But remember, when it's an autoimmune issue, it's not a thyroid problem. And just by giving you levothyroxine, that doesn't fix the autoimmune issue, right? So we're going to see maybe overdosing with thyroid replacement hormone sometimes when you have Hashimoto's, and we'll I'll talk about why that is. Insulin resistance certainly is going to affect hair follicle metabolism and is really the underlying mechanism for thyroid not working as well in the hair follicle, right? So insulin resistance is huge. And again, I give much more information about that during the master class. All right. So as far as over or under dosing, okay, this really just it directly disrupts T3 driven hair follicle cycles. All right. So there are 4 cycles, and you can either have too much or too little. And because T4 actually converts locally right there in the hair follicle where it's growing out, um, that is where some T4 to T3 conversion happens right there at the follicle. So um, studies definitely show that both excess and deficiency in levothyroxine can cause hair loss, but excess levothyroxine can push the body into a hyperthyroid state where you have, again, this is by conventional measurements, labs, low TSH and high free T4 or T3. And this will accelerate the hair growth cycle and cause premature shedding. And the big name for this is telogen effluvium. Insufficient levothyroxine can leave the body hypothyroid, where you would normally have higher TSH and low free T4 and T3 hormones. This slows hair growth, and that leads to thinning or brittle hair. All right. So hypothyroidism often causes dry, coarse hair that falls out easily, right? Small changes in TSH can affect hair follicles too, right? So therefore, frequent dosing adjustments, all right, causes causes frequent TSH fluctuations, and this will stress the hair follicles. Okay. All right. Now, when there's nutrient deficiencies, we often need to check things like your ferritin, your iron. We check tests that tell us about B12 levels and zinc levels and vitamin D levels, because these deficiencies are common in patients taking levothyroxine, and this contributes to hair loss. Okay. Also, you may not absorb the levothyroxine very well, like I said earlier, and that's going to perhaps lead to hair loss. Okay, so that's one of the probably the most common side effect that I hear about is hair loss. Now, the next one is palpitations. And you raise your hands if you've had palpitations with taking levothyroxine. It's really common too. And so this can occur due to several reasons related to, its effects on the body. And so the first one I'm going to talk about is excess thyroid hormone levels. Again, increasing thyroid hormone levels in the blood in your body can speed up metabolism and heart rate. All right, that makes sense. If the dose is too high, it may lead to hyperthyroid-like symptoms, including palpitations. Okay, and the heart has to work harder than normal. Okay, what about individual sensitivities? So some people are more sensitive to thyroid hormone changes, and even a standard dose can cause symptoms like rapid or regular heartbeats, especially during the initial adjustment period. And again, I said that can take several weeks. And it can be a little disconcerting, but if you know what's going to happen possibly, then hopefully you'll be a little more at ease about it. Now, if you have pre-existing heart conditions like arrhythmias, if you say you have some heart block or AFib, or maybe you have coronary artery disease, this can make the heart more reactive to thyroid hormone changes. And this can also lead to palpitations. Electrolyte imbalances, this is a biggie, okay? So thyroid hormones can affect electrolyte levels, especially potassium, sodium, calcium even, which are critical for heart rhythm. Okay. So imbalances in these, you know, also caused by adrenal dysfunction may also trigger palpitations. So too little thyroid hormone, we talked about too much, right? But too little thyroid hormone can cause electrolyte imbalances too, due to chronic understimulation of adrenal gland tissue. This leads to poor adrenal function and chronically imbalanced electrolytes. Okay, I see this more frequently than I do excess thyroid hormones affecting electrolytes. So electrolyte imbalances lead to blood pressure changes, right? Fluid changes, blood pressure changes, especially when you have lower blood pressures. This will definitely lead to palpitations where the heart has to work harder to get the blood pressure back up. And then other medications or stimulants. So certain things interact with levothyroxine, like caffeine and other stimulant medications, even if you don't take it at the same time. All right. This can amplify levothyroxine's effects on the heart, causing palpitations. Okay. And I mentioned earlier that there's an adjustment period. Okay. When starting or adjusting the dose, the body may take time to adapt. And this temporarily causes side effects like palpitations. Now, if these persist or are severe, right, you got to consult with your healthcare provider. Right? They may check thyroid hormone levels, but I get concerned because they only check a few. And I, again, address this at length during the master class. So you really will, if you're new to the group and you're here to just, to find answers for your issues, you definitely want to plan on attending the next master class. All right. And we'll be announcing that when we're getting, really, when we really nail down the planning and when we're ready to announce that. So they may check these levels, but again, they don't usually check all of the appropriate markers to see if you're on an appropriate dose. Herein lies the problem, because they are not checking all of the markers. It's very difficult to arrive at an appropriate dose. And so many of you are dealing with, your doctor's adjusting the medication up and adjusting it down and adjusting it up and down. It's never ending for some of you. And it's been going on for so long for many. Okay. And so no wonder you have these side effects, right? And you do want to avoid stimulants, like caffeine, which can worsen the symptoms. All right. What about nervousness or jitteriness or anxiety and taking this levothyroxine? So levothyroxine is T4, which is converted to the active hormone T3. It's triiodothyronine by an enzyme. Okay, it's called deiodinase or D1 and D2 enzymes in the peripheral tissues, including in your brain. And too much T3 from this conversion can overstimulate thyroid hormone receptors in the brain or central nervous system and the peripheral nervous system. So the nerves that are coming out from your brain on into your body. And the way it works is that T3 enhances adrenaline, you've heard of that, and norepinephrine, which some of you may have heard of, but maybe not all of you. And this amplifies the fight or flight response, leading to nervousness, restlessness, jittery feeling. Okay. Excess T3 can also reduce inhibitory GABA activity, okay, leading to central nervous system excitement once again. So then you might feel this jitteriness or uneasiness, right? So this can happen during the adjustment phase. So right after a dose changes or when you first start taking it, um, and it can last several weeks. Now, another mechanism is that too much T3 can disrupt serotonin and dopamine balance in the brain areas that are linked to anxiety regulation. Okay, so the amygdala, for those of you uh, anatomy nerds out there, and the prefrontal cortex. Okay. Now, low T3 can cause nervousness too. So if you have issues converting T4 to T3, whether it's a genetic issue or from nutrient deficiencies, which is by far way more common than genetic, okay, then low T3 or erratic T3 disrupts neuron function in general. And this leads to anxiety or irritability simply because the sympathetic nervous system activity is increased. Okay. Imagine you have inconsistent voltage coming into your house. And now you're dealing with like flickering lights or lights that go off and on and appliances that don't operate properly. You know what? I mean, I know you don't necessarily have that, but think about what would happen if that were the case, right? Things would just not work and you'd be in a huge state of chaos in your house, right? So think about it like that. When you have inconsistent T3 levels, then yep, this is going to disrupt neuron function in general. Okay. Your nerves are wondering if they're really going to be plugged in or not, right? So, okay. Now, because of this pre-existing anxiety or a lot of stress going on or other conditions too can be exacerbated or worsened, let's say, by levothyroxine if dosing pushes levels a little too high. And this would increase cortisol and adrenaline because it's stressful. It's even more stressful on the body. And again, you may not be absorbing levothyroxine super well due to the excipient ingredients like the lactose and the dyes, which these little tablets are made with, which can cause inflammation or even allergic responses that mimic anxiety or nervousness. So that's another reason for, these types of side effects. Now, a few have mentioned that they've gained weight on levothyroxine. And certainly this may be true with underdosing of the medication, especially after, and I hear this the most with people that have had their thyroid removed because of Graves or thyroid cancers or things like this. And so they're just not put on enough thyroid replacement hormone. And so they gain weight after the thyroid's removed because the thyroid hormone's now gone from their body. And now they're in a state of hypothyroidism and they're not getting enough in the dose, right? And that's why it's so frustrating because a lot of times, again, they're just checking the TSH and it seems to go down well enough. And so they think they have you on enough of this thyroid replacement. When in reality, they're not checking anything else. They're not checking the T4 or the T3 or the reverse T3 hormones. All right. Because weight gain would, with levothyroxine, especially if you have some other conditions, I'll get into that, can be because you have, again, underdosing or you have underlying infections or insulin resistance, or you have toxins. Because then taking levothyroxine will lead to more of a conversion of T4 to reverse T3. And if you've never heard of this, I guarantee your doctor hasn't heard of it. Okay. Reverse T3 acts as the brake pedal and it slows you down because it's essentially your brain's picking up on these conditions, these infections, this insulin resistance, these toxins that can cause the insulin resistance, or, foods can cause the insulin resistance. And your brain's like, well, I can't allow this cell to make energy or it'll die because there's too much toxicity involved already. And your brain's job is to keep you alive. So it won't allow certain cells to make energy, and then you won't be able to release fat because your brain's it's in the mode of if there's not enough energy, we've got to conserve energy while you're getting through this. And so we've got to store fat. Okay. Pretty logical, really. It's just kind of common sense, like I said. And so, um, too much reverse T3 will slow down metabolism even more, and that can result in weight gain. Okay. All right. So those are the most common things. Sweating happens because of the sympathetic um, excitement, let's say, the sympathetic stimulation, and that will, lead to more and more sweating at the skin level. All right. And so that's typically seen with, like I said, underdosing with or too little or too little or too much T3 from T4 conversion or not conversion. And so that those would be the most common side effects. Now, I do want to touch on, someone had many people ask about the medicines that, a lot of times you're given for hyperthyroidism or Graves. Okay. So methimazole or Tapazole is the brand name, but that's no longer really available in the United States. I know some of you may still be on it, but methimazole for Graves. I was asked about why would there be a metal taste in your mouth? Well, the most common side effect is loss of taste, or a common side effect of methimazole is loss of taste, period. And so then you tend to get more of a metal taste in your mouth. And now I made a note of some of these side effects for methimazole. So salivary gland issues and enlargement can be a side effect. Alopecia, uh, gastrointestinal issues. So like, once again, nausea and upset stomach, maybe even constipation. All right. Common side effects of, other side, well, let me not get too far ahead of myself. Joint pains, muscle pains, headaches, drowsiness, jaundice, lymph node swelling, water retention are common with this medication. So why would that be? Because methimazole blocks thyroid hormone production, and if you're on too much of it, it's going to make you hypothyroid, causing these symptoms. These are typical symptoms of hypothyroidism too. So they can be side effect or symptoms of insulin resistance, but in the setting of taking this medication for hyperthyroidism, it's going to make you hypothyroidism if you're on too much, hypothyroid if you're taking too much. And so you'll have these side effects. And and so, I'm sure so many of you are wondering if, some of the symptoms you're having are due to taking levothyroxine. Chances are that they are some of the symptoms of a mistreated thyroid condition. And again, in the masterclass, I discussed the number one cause of hypothyroidism, and it's generally an autoimmune condition, and we have to look at this differently. So taking levothyroxine isn't going to fix that problem, and you may very well have side effects as a result. And as you can see, these substances that our bodies make and that we, have synthetic substitutions for impact our bodies in very complex ways. But that is why it's so important to test correctly. Getting the right comprehensive tests is key to understanding what your thyroid physiology is up to so that we can best direct the treatment to be effective and safe. Okay, so I think we have a few questions, and I'm happy to take a few. Let me get over to that. All right, so why would thyroid meds cause you to lose estrogen or cause more skin dryness? So, because thyroid hormone also increases sex hormone binding globulin. Okay. And when that's increased, and that's because of it's stimulating your tissues more. And so an increase in sex hormone binding globulin will bind to estrogen. It'll bind it up. And so your active levels or your estrogen levels that are going to be helpful for you are going to be less because they're going to be bound up to this sex hormone binding globulin, right? It's like this globulin is going to handcuff the estrogen, and so it can't do its job, right? And so then that'll lead to, the problems that low estrogen causes, which can include skin dryness and hair issues too. That's another mechanism you know, for the hair loss. This is, again, it's so complex. Okay, the next one. I was put on levothyroxine for years after getting to 200 micrograms and TSH not going down. They added liothyronine to help the other medication. Now TSH is so low, it's immeasurable. Why is that? Because you may have a deficiency in a genetic deficiency in those enzymes that convert T4 to T3 in your tissues. So this may be a genetic problem. And so you're given the T3, and that is now working in the pituitary gland to drop the TSH. So it's inversely proportionate. It's it's a negative inhibition. Okay, meaning TSH is going to go high when your thyroid levels are low, and it's going to go low when thyroid levels are high. So it's just the opposite, right? And so when you increase the thyroid hormone levels, you're given the T3. Now that turns the pituitary down, turns down the volume of the TSH so that it's get now very, very low. And so that's why that happens. How is Armour thyroid different? Well, Armour thyroid is a combination of T4 and T3. Okay. So you have both. And so you bypass the problem of poor conversion when you're taking Armour. And a lot of times that's what a lot of you need, but it's not necessarily what you need. We really have to evaluate all the other reasons for and see what your pattern of hypothyroidism is first. All right. So unfortunately, because doctors are not getting all the pieces to the puzzle, they're not getting the full picture. They're literally guessing when it comes to dosing you with either the levothyroxine, maybe adding the liothyronine in, or maybe they decide to give you Armour thyroid, and they're just guessing. Okay. What if ferritin is high and hair loss is happening? It's because it may not be releasing. So ferritin is iron storage, and you may not be releasing enough iron into your tissues to help T4 to convert to T3. You need iron to do that. You also need iron to produce TSH in the pituitary gland. And so if you're lacking iron, you may be lacking TSH, and it's not stimulating your thyroid enough, and then you're not producing enough thyroid hormone, and you're losing your hair or getting palpitations. Can that cause seizures? Well, I'm not sure what that refers to, but levothyroxine, I'm guessing can levothyroxine cause seizures? Um, I don't think that's a that if it happened, it would be very, very rare. And really, you're gonna you're gonna inhibit. No, it really shouldn't. Um, but I guess in the rare instance it could, given maybe a complex, real complex imbalance or group of imbalances in your brain chemistry that would cause that. But I wouldn't I wouldn't say so generally. Is it a fact that eating fiber like flaxseed or chia seed within 2 hours can affect the absorption of levothyroxine? Um, it can affect the absorption, but I think you're probably safe if you're eating it within 2 hours. All right. Now, there's some really, I don't know, the research isn't great on this. If you take calcium within 4 hours of your levothyroxine, it may inhibit the way that works for you. Um, I always have people take it at least 30 to 60 minutes prior to eating or drinking or taking any other supplements. All right. So I think you're pretty safe if you're doing that. How do you get the right amount of the thyroid hormone replacement? Well, I mean, that's the golden question. And where um, it's where, think about this. If doctors are not getting all the pieces to the puzzle, and if they're not looking at your symptoms as well, it's going to be very difficult to get the dose right. Now, they may guess right, and that's great. But it's you've got to look at both the labs, the full set, and your symptoms. All right. So I don't have an easy way to answer that. That's why this is, you've got to be helped, managed by someone who knows. And that's why we've been able to help thousands with their thyroid issues to get better balanced. Okay. Will you have to be on this medication for life? It really depends, but typically so. If you've had enough damage to your thyroid because of autoimmunity, that thyroid tissue isn't necessarily coming back within your lifetime. And it won't. It typically won't. Um, I would say let's plan on it not coming back in your lifetime. Okay. Because it's not like the liver that regenerates. That's not what your thyroid does. Now, do I believe that your body can heal? Absolutely. And do I believe in miracles? Absolutely. And I've seen some pretty miraculous things happen. But for you, this general group, we're going to leave it at yes, generally you have to be on this medication for life if you need it. How do zinc and copper aid the thyroid gland? Well, you do need zinc as well to produce thyroid hormone, copper as well in balance. You need zinc and copper in balance for your brain, neurons to also produce the neurochemicals that you need to make TSH. Like you need to have proper dopamine levels and serotonin levels for your pituitary to even make TSH so that it can stimulate the thyroid. So you do need zinc and copper in balance for that to occur. Is there such a thing as a thyroid transplant? If there isn't, why not? That's great. I have never heard of a thyroid transplant. And I really don't know. I don't know why not. Um, I don't think anyone's ever thought to try it because they can just replace it. And that's certainly going to be a lot harder than just giving someone thyroid hormone replacement therapy that they think is going to fix the problem when they take your thyroid out. So I think it's just they've never even thought that that's something that's needed. Like the liver, you can't live without your liver. You'll need to have a liver transplant, right? If your liver's going belly up. So yeah, I think they think they've just fixed the problem with giving you the levothyroxine. Does the comprehensive testing identify as a person has that genetic condition? No, I don't know of even if there's a test for it. They just have identified that there seems to be some genetic condition where you don't have uh, the ability to convert T4 to T3 in their tissues. I can check on it though. I'll check on you, see if there's actually a test for that, but not that I'm aware of. Can high doses of levo 350 says grams, but it would be micrograms cause seizures? Again, I guess it's possible. It certainly is possible. If you were overdosed on levothyroxine, okay, then that very well could happen. Yes. Now, hypothyroid, severe hypothyroidism can lead to coma, and certainly that may even cause seizures too, where you are so hypothyroid that your brain is struggling to function at all, and it gets uh, it very much imbalanced. Okay, but this is not something in general that any of you have to worry about. Is bovine source thyroid an option? Absolutely. Yep, bovine source thyroid is absolutely an option. All right, I'm going to wrap it up. If I don't see any other questions, just let me make sure. Let me ask if Nikki or Cherry Ann see any other questions. And I don't think so. But that's a lot of information. And once again, I'm glad we got to meet tonight and talk about this because it's so common. The question is so common. Is this a side effect of taking this medicine? Is this a side effect of taking, Synthroid or whatever? Okay. One last thing. I think this is trying to say, can levothyroxine have bad effects on your health? I mean, if it's causing these symptoms, and then you get, these side effects, can certainly lead to, discomfort and symptoms and yeah, when you're not stimulating the right things in your body, which is what thyroid needs to do. It needs to start the motors, the metabolic motors. That certainly can have an ill effect on you. Yes. But it's not just because you're taking this levothyroxine. Most of the time, I really can't even generalize it. When you need it, you need it. And just by virtue of taking it doesn't necessarily mean it's going to have ill effects on your body. So for those of you who, and maybe, yeah, let's kind of wrap it up with this statement. For those of you who are thinking, man, I really wish I could get off of this medication, or can I get off this medication? For those of you who actually do need thyroid hormone replacement, and I would say most of you who have hypothyroidism do need it, whatever the source, whatever whether it's a synthetic or a natural desiccated thyroid, you need it to function. And then yes, then not getting it will cause other health issues and lead to a greatly diminished quality of life. I think your focus needs to be on understanding what your particular situation is, what you're missing in your care. And that's exactly why you should all attend the masterclass, okay? Because we talk so much about that during that time. It's a week-long event, okay? And so, well, it's not like all day, all week, but every evening for a week. And I give you so much information about this. That's why you really ought to make that a priority to watch. Um, so um, another question snuck in, and it's about balancing estrogen if you have to take this for life. And again, it comes down to your individual situation. But yes, that's why hormone replacement exists. And you may be able to take that as well if you need it. But let's make sure you do by taking a look at your individual situation. Okay. Very good, ladies. Thanks so much for attending Wellness Wednesday tonight. Again, it's always a pleasure. And I really hope that this has shed some light on what this medication can implicate, but also to give you the notion that it likely is very much something you may need, but it can cause side effects if it's not managed correctly. And getting the right information is the key to this being managed correctly and effectively. Okay? So have a great evening. Have hope. Remember, there are answers, and you still have the power to heal. Take care.